Hello, and welcome to the Supervisor Drug-Free Workplace Training. As a supervisor, it is your responsibility to maintain a safe, secure, and productive environment for employees, evaluate and discuss performance with employees, treat all employees fairly, act in a manner that does not demean or label people. It is not your responsibility as a supervisor to diagnose drug and alcohol problems, have all the answers, provide counseling or therapy, or to be a police officer. Legally sensitive areas. Safeguard employees' confidentiality. Ensure the policy is clearly communicated. Establish procedures to thoroughly investigate alleged violations. Provide due process and ample opportunity for response to allegations. If testing is included, ensure quality control and confirmation of positive tests. Distinguishing between a crisis situation and a performance problem. Crisis situations are less common than performance problems and can consist of dangerous behavior, threatening behavior, obvious impairment, possession of alcohol and other drugs, and illegal activity. Examples of common performance problems that may be indicators of underlying addiction include poor attendance, tardiness, unexplained absences, long lunches, coworkers or customer complaints, mistakes and missed deadlines. Ongoing performance problems that do not respond to normal supervisory actions may be signs of addiction and other personal problems and may require more intervention. After constructive confrontation and referral, the employee will need continuing feedback about behavior and performance, encouragement to follow through with continuing care and support groups, accurate performance appraisals and fair treatment, time to adjust to doing things differently, respect for his or her privacy, open lines of communication, and corrective action if old behaviors reappear. Constructive confrontation. Tell the employee you are concerned about his or her performance. State the problem. Refer to documentation of specific events. Avoid overgeneralizations. Ask for an explanation. Avoid getting involved in discussions of personal problems. Try to get the employee to acknowledge what you see as the problem. State what must be done to correct the problem. Set a time frame for performance improvement. Specify consequences if the problem continues. Do emphasize that you only are concerned with work performance or conduct. Do have documentation or performance in front of you when you talk with the employee. Do remember that many problems get worse without assistance. Do emphasize that conversations with an EAP, if applicable, are confidential. Do explain that an EAP, if applicable, is voluntary and exists to help the employee. Do call an EAP, if applicable, to discuss how to make a referral. Don't try to diagnose the problem. Don't moralize. Limit comments to job performance and conduct issues only. Don't discuss alcohol and drug use. Don't be misled by sympathy, evoking tactics. Don't cover up. If you protect people, it enables them to say the same. Don't make threats that you do not intend to carry out. For supervisor referrals to be effective, an employee needs to know that problems will not be made public, conversations with an EAP professional or other referral agent are private and will be protected. All information related to performance issues will be maintained in his or her personnel file. Information about referral to treatment, however, will be kept separately. Information about treatment for addiction or mental illness is not a matter of public record and cannot be shared without a signed release from the employee. If an employee chooses to tell coworkers about his or her private concerns, that is his or her decision. When an employee tells his or her supervisor something in confidence, supervisors are obligated to protect that disclosure. If you have any questions in regards to the drug-free workplace policy, please contact your Human Resource Department.